Good day, my name is Danielle Villaseñor. For this video, I'll be changing an occupied bed. For the overview of the skill, after a bath, clean linen should be placed on the bed to promote comfort for the client. If the client is able to stand up or get out of the bed, you may assist the client to a nearby chair and continue to make the bed. In the situation where the client is not able to get out of the bed, you should change the linens around the client. Assistance may be needed if the client cannot turn or in a traction. If the client cannot turn, change the linens from head to toe. You must place a waterproof draw sheet underneath the client if the client is experiencing incontinence or have profuse drainage. The type and amount of linens are based upon the client's type of bed, as other type of beds such as air beds and clinitron beds usually use minimal amount of linens underneath the client. For the assessment, you're going to have to assess your equipment. Check for all the linens necessary to change the bed. Check for the dirty linen hamper, and this facilitates a smooth procedure. Second, you're going to have to assess whether the bed itself needs cleaning prior to placing the clean sheets on it. This reduces transmission of microorganisms. Third, you're going to have to assess the client's needs in the bed. You're going to have to check for profuse drainage, incontinence, or special needs for the client's comfort or skin integrity. This determines how the procedure will be performed. Fourth, you're going to have to assess the client's ability to assist with the procedure, including their mobility, their mental status, and their muscle strength. This determines whether the assistance will be needed to change the client's linens. As for the planning, the expected outcomes for these procedures includes the following. The client will have clean linens on the bed. The client linens will be appropriate to the client's needs and condition. And lastly, the linens will be changed with a minimum trauma to the client. For this procedure, you're going to need the following equipment: linen hamper, top sheet, draw sheet, and bottom sheet, pillowcase, blanket, and bath blanket. For the implementation, first you're going to have to explain the procedure to the client. This promotes client cooperation.
Good afternoon po, ma'am. My name is Danielle Villaseñor. I'm your student nurse from NUST. So, first one, may I know your name, please?
My name is Kali Makaso.
Okay po, Miss Kali. So, Miss Kali, ang gagawin ko po ngayon is papalitan ko po yung bed sheets nyo and yung puputi nyo. So, given your situation, medyo mahirap po para sa inyo tumayo tayo, saka habang inaayos ko po yung bed ninyo. So, gagawin po natin to habang nandiyan po kayo sa higaan. So, is that okay with you?
Yes, okay lang naman.
Okay po, ma'am. Thank you po.
Next, you're going to bring the equipment to the bedside. This facilitates a smooth procedure. Third, you're going to remove the top sheet and blanket. Loosen the bottom sheet at the foot and sides of the bed. Client may be covered with a bath blanket. This facilitates easy removal of linens. Bath blanket prevents exposure and chills.
Okay, ma'am. So, I'll give you a privacy blanket po.
Fourth, position client on side, facing away from you. Reposition pillow under the head. This provides space to place the clean linens. Fifth, you're going to fan fold or roll bottom linens close to the client towards the center of the bed. This keeps the soiled linen together and promotes comfort when client later rolls to the other side. 6. You're going to smooth the wrinkles out of the mattress. Place the clean bottom linens with the center fold nearest to the client. Fan fold or roll clean bottom linens nearest to the client and tuck under the soiled linen. Maintain an adequate amount of sheet at the head and foot of the bed for tucking. This provides maximum fit of sheets and decreases the chances of wrinkles. 7. You're going to meter bottom sheet at the head of the bed, then at the foot of the bed. To meter, lift the mattress and tuck the sheet over the edge of the mattress. Lift the edge of the sheet that is hanging to form a triangle, and lay upper part of the sheet back onto the bed. Tuck the lower hanging section under the mattress. Repeat for each corner. Tuck the sides of the sheet under the mattress. This holds the linens firmly in place. Next, you're going to roll the client over onto the side facing you. Then you're going to move to the other side of the bed and remove the soiled linens by rolling into a bundle and place in a linen hamper without touching the uniform. This movement prevents cross-contamination. Then you're going to unfold or unroll the bottom sheet, then draw sheet. Look for any objects left in the bed and then grasp each sheet with knuckles up and over the sheet and pull tightly. The tight sheet keeps the linens wrinkle-free and decreases the risk of skin irritation. Next, you're going to place the top sheet over the client with the center of the sheet in the middle of the bed and fold top of the sheet over the client. Remove the bath blankets left on the client to prevent exposure during bed making. Place the top blanket over the client and same as the top sheet. This provides client with top sheet and blanket to prevent chilling. Next, you're going to raise foot of the mattress and tuck the corner of the top sheet and blanket under. This secures the top sheet and blanket in place. Next, you're going to remove the soiled pillowcase. Grasp the center of the clean pillowcase and invert pillowcase over hand or arm. Maintain grasp of the pillowcase while grasping the center of the pillow. Use other hand to pull pillowcase down over the pillow. Place the pillow underneath the client's head, and while changing the pillowcase, the client can be instructed to rest the head on the bed or place a blanket underneath the client's head. This procedure provides clean pillowcase without shaking pillow or pillowcase. This promotes comfort for the client as well.
So, Miss Callie, do you feel comfortable in that position po?
Yes, comfortable naman.
Ramdam ninyo? Do you feel comfortable with your sheets?
Yes.
Okay po, ma'am. So, yun na po, ma'am. Thank you po.
Thank you then.
Next, you're going to document the procedure used to change the linens and client's condition during the procedure. This provides documentation of nursing care and assessment of the client's status. Then you're going to wash your hands. This reduces the transmission of microorganisms. For the evaluation, the client has clean unwrinkled linen. The linen placed on the bed is suitable for the client's special needs. And lastly, the linen was changed with a minimum pain and trauma to the client. As for the documentation, you have to document in the nurse's note the bed change and how the client tolerated it and any unusual findings along the procedure. That is all for my video. Thank you for watching.